Hi, I'm Jared Serbu. And a couple weeks ago here at Federal News Network, we published an article based on a long interview that we had done with Lieutenant General Talita Crossland, who's the director of the Defense Health Agency. That interview itself was really all about DHA's new strategic plan. But in the course of that discussion, we also talked about the healthcare crisis that's been facing civilian employees in Japan starting about a year ago. And again, in the course of that discussion, she told us that the problem has been essentially resolved at this point.
What we have since done is we've gone back and we've sat down with those military treatment facilities and we've worked through what their challenges are on meeting their demands. And we've unencumbered them to support the Space A on the same footing they had previously supported the Space A. Right. And so we did that part. That was the memo that came from the agency, I guess, in about February, March timeframe, would say, time out. We really do have some capacity. Let's maximize our capacity for all beneficiaries in Japan, our active duty family members. There are tools we have to make sure they get in, but we shouldn't make the tools so tight that Space A can't get in. That wasn't, so we pulled back on that. And all the military treatment facilities in Japan are able to see Space A and pretty close back to where they were before the policy that had created all the angst. So we're back to where we were.
And that quote from Crossland generated more pushback, more feedback from our audience than I think any story I have ever done in the 13 years I've worked here at Federal News Network, Federal News Radio before that. Employees in Japan told us that in reality, really nothing has been fixed, although there are some differences in different parts of the country. But one concrete example for that is at Naval Hospital Yokosuka, which actually publishes its appointment availability on its Facebook page. And what you can tell from looking at that data is there were very few appointments available to civilians in the entire month of November, very few days in which there were any appointments available. And what civilian employees also reminded us of is even those space available appointments, TRICARE beneficiaries like retirees get first crack at them. They can make appointments to take advantage of those slots before civilians can. So even on those days when there is theoretically some appointment availability, civilian employees may still not get a shot at actually making one. You can read much more about this issue in this week's Federal Report at federalnewsnetwork.com.